let's talk Lyme. Lyme's disease is crazy. No one seems to really know much about it. It's really tricky, and we have it happening in our area. So, I mean, it's expanding even into the cities. So we have a question here that says, Lyme's disease, what can be done to prevent it? How do we know if we even have it? Aren't the tests notoriously inaccurate? Tell us about Lyme's disease.
Yeah, Lyme disease. Okay, so we're in Lanark, Leeds, Grenville, right?
Yeah, which is like the epicenter of bad Lyme
certainly,
zones.
it's high in our area, right? And it's only expanding, right? Every year it expands further and further north. So it's up at least as far as Sudbury. That was at least a couple of years ago. There were dogs testing positive for Lyme.
Holy moly.
It's everywhere. It's in northern Alberta, northern Saskatchewan, across the country. So it's here. So number one way to protect is, of course, awareness, right? So awareness of what it is, awareness of the ticks that carry it, awareness of their actual size and what you're looking for.
Because they can get really small, like the nibs.
Very small. And so, I just find a lot of the literature, right, always shows this blown up photo of a tick. So it looks like the size of a ladybug. You're like, oh, I'll see that.
Yeah, I would notice that.
But really, the nymph size are like poppy seed size. So it can look like a freckle.
Size of a freckle.
So awareness, of the tick, and of course, then doing a tick check, we call it in our house. Yeah. So especially with kids, but everybody, having
check yourselves,
somebody spot
check your partner.
Right, back and hairline.
We actually call it Lanark foreplay at our house. Come on, baby, let's tick check each other. Get
so
right in
that's
those crevices.
That's just a new reality that we all have to adapt to and get used to that, make that a habit, right?
Yeah.
So okay, and then obviously, the clothing and blah, 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 if you're hiking. So light clothing, tucked in, that sort of thing.
Tuck your pants in your socks.
You look really cool.
You look so cool.
You look so cool.
Yes.
But anyway.
You don't look cool with Lyme's disease. So tuck in your pants.
Yeah, it can be troublesome. Yeah, it's a tricky thing because the manifestations of Lyme can be all over the place, right? There's something like 50 or 60 known symptoms that are attributed to it, right? So it's called, the great imitator. It can look like ALS. It could look like Parkinson's. It can look like carpal tunnel syndrome. So even though, yes, there's no sort of definitive blood test yet. So the test can be very inaccurate, and depending on what stage of the illness, right, you may not get a positive blood test for at least 6 weeks after you've been infected, but then the longer you wait, that immune response can go down. So then it's negative then. So if you test too early, you can get negative. If you test too late, it might not show up depending on what you're measuring. So it's difficult. We hear about the bullseye rash. So if there is a bullseye rash, that's what we call pathognomonic for Lyme. There's no other disease that causes a bullseye rash. So if you see that rash,
it's for sure.
Go, to your doctor, get medical treatment, which should be at least 3 weeks of antibiotics in an acute situation. Absolutely. I would do the same thing.
I think my experience has been, 1 week. Or one shot,
or a single dose.
They give you one dose of the serious shit kicker stuff.
3 weeks is better.
Okay.
Acutely, and usually that can nip it, right? Because it hasn't had a chance to go run and hide and get deeper into the tissues. The problem is that rash is only there 20 to 40% of the time.
Right. So sometimes people miss it.
Just because you don't have a rash doesn't mean you don't have Lyme, right? And suddenly your joints hurt, you're tired, or you've got tingling, right? So that could be the first sign. So how do you know you've got it? It's technically a clinical diagnosis. That means based on your signs and symptoms, a practitioner will make that call. But then you've got to sometimes rule out a whole bunch of other things. Say it's not this, it's not that, it's not MS, it's not this, it's not that. So Lyme's the only possible thing, right? But to test directly for it is difficult, and still it's quite inaccurate. So
do you know, are they working on that? Have you heard through the medical grapevine?
There was something earlier this year, and I can't remember what the test was, but there seemed to be kind of a new test that was showing promise. So I don't think it's commercially available yet, but there was at least a jump, maybe even last fall. So yeah, it's a tricky one, but awareness is first, and hopefully, and speaking to your health practitioner, right? Because the awareness among the medical community, I think, is quite variable, right? So some people are really on it. Others, up to a few years ago,
People thought it wasn't real.
Didn't believe it existed here, right? But yeah, so, prevention is the best defense. And after that, yes, there's a lot of things naturopathic medicine can offer, but the earlier you can catch it, and if you can combine natural treatments with, even a relatively short course of antibiotics, then that's the best outcome.
Right. If you get the tick off faster, are you going to have a lesser chance of contracting the disease? Does that have anything to do with it? How long the tick is in your
certainly
skin?
The length of time the tick's attached. Obviously, the longer, right, the more chance it has to transfer saliva, which contains the germ, that sort of thing. But I think it's, you'll read, it has to be attached for 24 to 48 hours for anything to happen. And that's just ridiculous. Like, who's standing there with a stopwatch saying, okay, now is when the bacteria transferred. 24. So no, I mean, I have colleagues in the US who've seen transfer occur within hours.
Wow. So
like less than 6 hours.
Okay.
They know it was attached for less than that. The person ended up with Lyme disease. So, so just don't have that false sense of security. Like, well, I got it after 12 hours.
All this time, have that false sense of security.
Right. So again, and as I said before, in any infectious disease, right, there's the germ, you need the germ, and you need the terrain, right? So why if some people get kind of the chronic symptoms of Lyme disease and some don't, right? So again, that goes back to immune system function, the health of the person, how robust is that defense? So obviously we're always trying to shore that up. Which can be a preventative strategy, but then also, of course, treatment. If you do come down with symptoms, then you have to be, diligent with doing that to recover. So.
Okay. So if you find a tick on you, are there certain symptoms that you can be looking for? Like, are there things you should be looking for after you found a tick on you? Just any change at all? Or
like, how do you don't want to run to the ER every time you have a tick on you, right? Or do you?
No, I mean, you can try to, so obviously proper removal, right? So if you get one of these tick removal kits, they've got these different little sized crowbar things.
Yeah.
So you can just sort of wedge it straight back.
Okay.
So, which can be sometimes easier than tweezers, because tweezers kind of slip off. You can't get the right grip. So having the right tool is important. And then always save it, right? So put it in a little plastic container with a bit of wet Kleenex or gauze.
Okay.
And keep it alive if you can.
Oh.
And then, again, through CanLyme, you can find places that'll accept it for testing, right? So see, does it actually contain this?
So am I supposed to test it every time?
Well, no, but I mean, it can be helpful, or, if it's been there for a long time.
So if you find an engorged tick, maybe that you
Sure. If it's engorged, for sure, because it's been feeding there for a while. So you'd want to check that out.
Sometimes they're so deeply embedded too. Like sometimes they're easier to pull out, and sometimes they're they're really in there. Is that
so? Well, then that might be a case for the ER, right? It's like a minor surgical
right
procedure to kind of dig it out. Sometimes that's the appropriate way to do things.
Okay.
So
should we shift gears?
Can we? I'm so scared of Lyme's disease. I'm so uncomfortable right now. Ooh. You should be scared of Lyme's disease, folks. It's fucking scary and sneaky. It's a boogeyman of Lanark County. Fucking Lyme. All right.
Well, if that's the boogeyman of Lanark County, then
then you're in the clear. Ew. Mel's always outside my window, just peering in, tapping at the glass. Oh, it's
long
just Mel.
Fingernails.
Hello, it's Dr. Shawn Yakimovich from the Kempfield Naturopathic Clinic, and I'm here today to discuss some naturopathic approaches of what you can do if you experience a tick bite. So, it's springtime, and obviously that means high season for tick activity and, of course, tick bites. So, in the event that you remove a tick off yourself or your child, here's a few things you can do to hopefully help prevent the transmission of the bacteria, the infection that causes Lyme disease or some of the other infections that ticks carry. So number one, obviously, is rapid removal. The sooner you can get the tick off, then the lower the chances of any disease transmission. So rapid, proper, safe removal of the tick is important. If you don't know how to remove a tick safely, or if you don't have the right tick removal tools in your first aid kit, you can go to canlyme.com. It's an organization, national organization that provides videos for how to remove a tick, as well as they sell tick removal kits, which have some really handy tools and everything you need to remove a tick properly and safely. So basically, though, what you want to do is grasp the tick by the head as close to the skin as possible and just pull it straight out. You don't want to squeeze the body of the tick in any way, because this has the potential to inject the contents of its digestive tract into our bloodstream, and that's where the bacteria is. So after we remove the tick, we want to wash the wound with soap and water, so just basic hygiene there. And after that step, you can apply what's called a drawing poultice. So a poultice just means a moist mass of usually plant material. So what you can use as a base is either activated charcoal powder or clay powder, such as bentonite clay or green clay. You use this as your base, and then we just want to moisten that powder. So either hot water will do, or you can use plantain tincture or calendula tincture. We'll just add a little extra medicinal value, and make a thick paste. Apply this liberally to the bite site. Cover with some clean gauze and surgical tape. And you can leave that poultice in place for 2 to 4 hours, and then change it every 2 to 4 hours for a day or two until any redness is diminished from the site. And so the idea here is we want to draw out any saliva that the tick may have injected as soon as possible, so that it reduces the chances of bacteria from going into our system. So at the same time, there's a homeopathic remedy called Ledum, Ledum, and if you can find it in a 200 potency, then the dose for this is 1 pellet 3 times a day for 7 days. And what this does is help activate our immune system against the bacteria and help clear the infection before it gets started. And finally, there's another supplement you should be able to find in health food stores called serrapeptidase. serrapeptidase. So this is just an enzyme, and research shows that it's a very effective substance at breaking up what's called biofilm form of the bacteria that causes Lyme, the Borrelia. So when the Lyme bacteria is first infects us, it's usually in a corkscrew form. But this bacteria is notorious for changing its form. So one of the forms it can change into is called a biofilm, which makes it very resistant to any treatment, whether that's antibiotic or natural treatments. And it evades our immune system when it's in that form. So we want to disrupt that and not let the bacteria achieve that form. So serrapeptidase, you can take it 3 times a day on an empty stomach for 3 weeks. And again, clinical research shows that this will help disrupt the life cycle of the Borrelia, making other treatments more effective and making our immune system more effective. So those are a few things you can try. Now, the caveat here is, if at any point during this 3-week treatment cycle you develop symptoms, so any kind of rash around the bite site, a bullseye rash especially, but any kind of rash, if you suffer joint pain, kind of flu-like symptoms, achiness, fever, even though it's the middle of the summertime, migrating joint pain, numbness, tingling, kind of nerve-like symptoms, trouble concentrating, you can't find the right words, sort of a memory loss. If any of those symptoms develop, then certainly get to your medical doctor immediately, because that indicates that you do have active Lyme, and antibiotics, usually a 3-week course, can be very effective at that point. Now, if it does come to that and you do need a referral for antibiotics, continuing the protocol I just mentioned is very complementary and will allow the antibiotics to work better. So you can maintain that at the same time. So those are my tips. Enjoy the summer. Be aware. Be vigilant. Know what to do, and but don't be afraid to go outside. So this is Dr. Shawn Yakimovich. You can find me at KempvilleNaturopathic.com or on Facebook at facebook.com/KempvilleNaturopathic. And if you have any questions, please let me know. Thanks for your time.
Teach me, tiger, how to tease you. Whoa, 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 whoa. Tiger, tiger, I wanna squeeze you. Whoa, 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 whoa. All of my love I will give to you, but teach me first, tiger, or I'll teach you.